This past September, the FDA released new guidelines to continue encouraging innovative approaches to their development of digital health tools to ensure their agency's approach is advancing at the same pace. I'd like to invite a special guest to the stage from the FDA, along with our moderator, reporter of Stat News, one of my personal favorite publications, Megan Thielking.
Good morning, everybody. My name is Megan Thielking, and I'm a reporter at Stat, Health and Medicine publication, and I'm very excited to be taking part in this chat today with Dr. Amy Abernethy. Dr. Abernethy is an oncologist, a clinical researcher, a clinical data expert. She's currently the Principal Deputy Commissioner at the FDA, and she also oversees the FDA's technical vision and data vision as the Acting Chief Information Officer. She's also held executive roles at Flatiron Health and was a professor of medicine at Duke. So we're very glad to have her this morning to talk with us about digital health and regulation. Welcome.
Thank you. Nice to be here with you.
So let's get started. So the title of this talk is Demystifying Regulation. It's been roughly a year since you joined FDA. I'm curious what you were mystified about before you started and how that has changed in the last year.
So I came from the health tech space and the academic world and had really been looking at FDA from the outside. And I think I'll use real-world evidence as my example of what I've learned coming from the outside inside of FDA. So a bit of background, real-world evidence was compelled through the 21st Century Cures Act to be a place where we're looking at how do we use real-world evidence for things like label expansions and post-marketing commitments. And I was expecting when it was in the act that, boom, we would just be moving forward and this was now a done deal. Certainly I was also seeing in academia and in industry, we were having all of these really exciting conversations, and FDA was part of the conversations. And so I then came to FDA and learned a lot about what does it mean, though, to go from a place of basically saying we need to think about this to now what does it mean to take it up and do it. And so I learned a number of things inside of FDA. I learned about the fact that FDA has to make sure that we know whether or not products are appropriately safe and effective, and that we maintain that standard, and that as we start to figure out real-world evidence, we don't disrupt the standard just because we've been told, listen, think about new evidence approaches. And so how are we going to wrap real-world evidence into the process of developing our understanding of when products are safe and effective in a way that maintains the standard? I learned about this idea that we have certain authorities, so certain places where the law has said this is what you can and cannot do, and sometimes those authorities don't always match up to what we want to do or the public wants us to do, and we have to figure out how do we align those. I also learned that, for example, with something like real-world evidence, across the entire industry, including within FDA, we need to learn how to use something and do something confidently, and we need to learn what are the tool suites, what are the analyses, how do we know which use cases are appropriate, which ones aren't, and so we've got to do all of that work. So now stepping back, why does this matter for an audience like DES and CES? And practically speaking, as I reflect on what I've learned in the last year, which was your question, I realized that from my prior industry hat, even from my prior clinician and academic hat, it's really important to understand how do these processes work so we don't get ahead of ourselves and just assume something, for example, is a done deal, but understand what are going to be the stepwise tasks then to get from here to there, and as industry be able to participate in that conversation and make sure my company is appropriately prepared. And so I think I learned a lot about how these pieces come together.
Yeah, and I mean, obviously one of the big ongoing conversations at FDA, which is super relevant to everyone in this audience, is how you grapple with digital health in the software space. Can you give us some insight into what that conversation looks like at the FDA and how you're navigating when you regulate versus, I think you phrased it this way in the past, when you sit beside a company?
Yeah, so one of the things I've learned since coming into FDA is that at FDA we regulate products. So for example, we regulate drugs, or we regulate food, or we regulate veterinary products or cosmetics, and each of those products have different specific regulatory approaches that are specific to the product type. Now, as we think about the landscape of data and technology companies, digital health, we've not only got totally new product suites, but we also have companies that are able to basically innovate with the speed that many of our typical product category regulatory processes don't necessarily align with. We've got the issue that many of the data and technology companies ultimately have the ability to embed, for example, algorithms that are learning, and how do we align with that? And so as FDA, what we need to do is step back and say, do we have the right regulatory pathways to essentially align with these new product categories? And how do we make sure that the regulatory pathways that are being put in place can maintain fleet of foot, for example, to go along with the technology space, but also that we make sure that we're, in a risk-based way, regulating those areas that have the highest risk, but as you said, appropriately sitting next to and providing essentially direction and advice, but not necessarily directly regulating those that aren't really, from a risk-based perspective, necessary for us to say yes, no, from a go, no-go perspective. And so I think that one of the things that has been really important in my reflection over the last year is that it's important that as technologies and capabilities change, we actually think about how do we change the regulatory pathways and approaches to keep up with that.
Practically speaking, doing that comes with some logistical challenges for the FDA. Can you touch on what those might look like?
Logistical challenges. Well, they actually come in a lot of flavors. So practically speaking, one logistical challenge is that we actually have to know what's going on out there. So we need to hear from technology and industry, here's where the space is going, so we can make sure that we're also anticipating what that looks like. It's a reason why FDA finds it important to participate in meetings like this, is to make sure that we're not only having conversations with different companies, but also anticipating direction. Second practical challenge is we have to make sure that we have the appropriate expertise inside the agency that matches the expertise that you have within your companies. And so practically there, it's not only that we need to know where the companies are going, but we need to think about who we need to hire. How do we compete for hiring, so to speak, in a landscape where there's a quest for talent in all directions? Another practical challenge is that one of the things I've learned in the last year is that rulemaking and legislation and laws, this is a slow and appropriately very deliberative process. And so the pace of that process and the need to be deliberative doesn't necessarily always match up with where the industry is going. And I can tell you a non-tech example in just a second in case you're curious. And that we need to think about how do we essentially make the process of appropriate deliberative legislation and rulemaking line up with changing industries. And you know, I actually think that the other thing that is an important challenge is that historically there was sort of fixed no-go decisions. And now we're in a world where we need to learn and adjust and update. And so we actually have to build that muscle. How do we essentially monitor performance across time and update understanding of, is this now still safe and effective as a product in the future? And so learning how to do that adjustment process in a more fleet of foot way is another kind of area that I think we're going to need to practice.
Give us your non-tech example.
So my non-tech example. So one of the areas I'm responsible for is thinking about how are we going to regulate CBD. And so cannabidiol, it is now a big question showing up in many different product categories. And the reason that I sort of think about what all has this taught me is that, I mentioned this issue of we regulate by products, and so CBD in cosmetics is going to be different than CBD as a drug, is going to be different than CBD in food or your jogging pants. There are CBD jogging pants. And that as we regulate by different products, we've got to make sure that we understand what the right alignment is, and do there need to be changes potentially to the regulations, or what's going to be go, no go in each of those spaces. So one is figuring out how do you maintain the ability by product category to get this right, while at the same time, the other big challenge is that this is a space that's moving forward very, very quickly. And so as quick as the last year has been with the explosion of CBD products across the market, figuring out how do you do that legislation and regulation at the pace to which the changes happening don't necessarily match up. And then the third part of this is that we live now in a world where we all want to be informed as quickly as possible. And so how do we learn how to communicate as quickly as essentially the American public and also all of industry wants, within the context of that's not necessarily the way it's been in the past. So I've been watching how both the digital health and the CBD space have lots of interesting parallels.
Yeah, I think there's a lot of overlap there. Because digital health is obviously a very, very fast-changing field. I mean, that's evidenced right here this week, both in terms of the technology and the space itself. There's always new deals, new partnerships, acquisitions. What are the challenges of participating in the digital health space when it's changing so quickly?
So it's interesting. One of the areas that we've been certainly trying to think through is, are there new regulatory approaches that we can essentially bring to bear to try and address this rapidly changing digital health space? And so one area that we've been thinking about is there are ways to essentially pre-certify or pre-assess companies that are doing development in order to make sure that we are ready to regulate the products that are coming from those companies as quickly as possible. So you might have heard about the pre-certification pathway, and one of the questions that comes up is, okay, well, if we pre-certify companies who are developing products as opposed to the products themselves, because as I said before, we used to think about the products themselves, and now suddenly ask this question about, do we need new pathways that have got to do with the companies? Well, wait a second, what if the companies now start shifting and changing? And one of the reasons for piloting or essentially pressure testing something like the pre-certification pathway is to understand what are the challenges we're going to run into, and then how are we going to do that? I think one of the things I've learned since I've been at FDA is the importance of transparency and making it clear these are the challenges that we are running into and seeing, and then making sure that there is the full ability to get stakeholder input through public meetings and public fora, and input from the companies who are going, for example, through the pre-cert process, and other ways of hearing from the public and from industry in transparent ways. And so this sort of piloting activity is intended to allow us to see what are the problems that we're going to run up against. For example, essentially recombination of companies.
Right, and you've already run up against that, correct, with Alphabet and Fitbit?
Yeah, so we're starting to see this. I'm not going to talk about specific products, but I'll tell you these are the general categories.
How would you respond to criticism of the pre-certification program, or concerns about whether it erodes the agency's approval standards when it comes to evidence, or whether there's not enough evidence to bring some of these products to market when you're taking the company-focused approach?
So we're a science-based agency, and we take our responsibility of making sure products are safe and appropriate for use very, very seriously. We are also, like you, interested in making sure innovation happens. So we have equal responsibility to innovate within health along with you. And so, I would respond to concerns by saying, practically speaking, we know we need to take new approaches. The industry knows we need to take new approaches. Pre-cert is one of those examples of new approaches that we really want to evaluate from all sides. We're not going to get it right, and it's not going to be perfect in the first pass. And I think we're seeing some of those challenges, but that's the reason why we consider it a pilot. It's the reason why it sits alongside of our regular regulatory pathways. It's not instead of those regulatory pathways, because we want to make sure that the regulatory pathways are continuing unabated. And this is a learning environment for essentially additional information and then make sure that we're doing our best to be as transparent about what we learn as possible. I would argue that if there is no concerns, then we're not taking enough we don't have enough creativity to try and figure out how do we go forward, because essentially we're probably not taking enough risk about which way to get there. And if there are too many concerns, then we're probably going too far. So I think that really what you see right now in pre-cert is the appropriate signals of, hey, watch this, or hey, watch that, and that's what we're trying to do.
Yeah. Another place that the FDA is trying to be creative and a little bit more flexible is within its own technology. FDA has been, knocked on at times for having outdated data systems. Can you talk about what's happening internally to get those data systems up to speed so that you can really play ball with some of the technologies that you need to regulate?
So when I came to the FDA, I came from the health tech space, and I was sort of thinking to myself, all right, we're here. We're ready to go with using data in all of the most modern ways at FDA. And what I realized when I came to FDA was, wait a second, our infrastructure is not prepared for the world where we all want to go. And practically speaking, having FDA's infrastructure as modern as the infrastructure that we're using across the consumer electronics space and DES, and also in Silicon Valley and New York and all the other places, is severalfold. Number one is it slows us down, and we're not able to be as efficient and automated as we want to be as an agency. Number two is it means that we don't have as much direct observation of what technology and data can do for us, and it also doesn't allow us to be as thoughtful on the regulatory side about how do we participate as active regulators within this environment. And number three is it doesn't allow us then to plan for what do we need to be thinking about for the future. As I've said before, we need to be sort of sensing for the future and figuring out where the agency needs to go, including things like hiring talent. So our Technology Modernization Action Plan really has been intended to make sure that we shore up and bring our current technical infrastructure into the most modern environment, that we start to use cases or sort of mini product scenarios to, inside the agency, start to imagine what does it look like as we become more modern. And then we also start to develop new conversations with the larger community of data and tech innovators. And those new conversations are intended to make sure that we understand what's the full distribution of technology and data solutions out there and also coming in the future, both those that we directly regulate as well as those that are adjacent to the FDA, where it's really important for us to be able to say, in a trustworthy way, here's what good looks like, and here's ways to think about going forward, and then also helps us plan for the future.
Can you give us a little bit of a look at what FDA's plan looks like for 2020 and what's up this year?
So in September of 2019, we announced the Technology Modernization Action Plan, and at the very end of the plan, there was a signal that 2020 and beyond would be the time for data. And so I think that now as we move into 2020, we announced just maybe an hour ago that this is the time now as the FDA we're going to start to focus on data. Why does this matter? Practically speaking, as an agency, data is sort of the basis upon which we make many of our regulatory decisions. So we need to make sure that as an agency, we're as modern as possible in how we think about, analyze, use data, and also, importantly, the decisions that we make as an agency about how we're going to manage and use data internally and how we're going to interface with the outside world are really important to the broader community of life sciences companies, healthcare, and companies that make data and technology solutions being used all across healthcare, including in the life sciences space. So this morning's announcement was for a public meeting on March 27th, which is intended to be a meeting where we're getting broad stakeholder input on everything from how should the agency be thinking about privacy and data sharing, to where do we need to be going with respect to questions such as standards, and ultimately, how do we start thinking about data exchange in the future? Why does this matter for the community here at DES and CES? Well, if you're a company that generates data to submit to the agency, or sells products to other companies that generate data to submit data to the agency, this is going to be a very relevant book of work and conversation for the future about how the agency is thinking about data and how we're going to interface with the industry. And so I think that today's meeting announcement signals where we're going. There's a meeting on March 27th. It's a public meeting. There's a public docket. I didn't really understand the whole public docket thing until I came to FDA. So basically what this means is a place where you can submit public comments, and that's been announced today as well in the announcement.
Can you talk specifically about the conversations that you're hoping to have with industry on how they can generate real-world evidence specifically that will matter to the FDA and will be something the FDA wants to see and can use?
So with respect to real-world evidence, as I mentioned before, we're learning inside the agency, how do we understand what does good look like with respect to data fit for purpose, analyses fit for purpose, what use cases can we use real-world evidence for? Also within this overall data space, we're starting to think about how do we communicate what does high-quality data look like? How should data be submitted to us? One of the things that we're also announcing today is that we developed something called the My Studies app, and that My Studies app really was intended to be an MVP, a minimal viable product, to showcase if you're collecting data directly from patients within the context of a clinical study, here's how the data can be collected. Here are essentially the applications to send that information to the FDA, but was built open source so that now other companies can build on top of it. And the announcement today is that one company, Google, has built an open source set of solutions on top of that to now continue to build new open source, but also real-world evidence solutions for the future. Why do I mention this? Because within the context of the real-world evidence space, we're trying to figure out not only how do we clarify what we're going to regulate, but also set the pace for here's the direction that things need to go, so that then you can start to build on top of it. And today's announcement about My Studies is a good example of that.
Outside of data, any other lasting sort of big picture things we should look out for from FDA in 2020?
So big picture around FDA in 2020, from my perspective, as you can tell, I'm very focused on this issue of data and technology because I think it pushes where we're going as an overall life sciences and healthcare community, but also where we're going as FDA in line with our public health mission. I think also what we should be watching for within respect to that is specific details where you can get involved and make sure your voices are heard. Public meetings, listening sessions, and you'll be hearing more about that from FDA.
Thank you so much.
Thank you.
Thank you, Amy and Megan.